Welcome. Thank you for joining us. Today we are here to talk about massage therapy, its benefits and what you can expect. So massage therapy is the manipulation of the soft tissues. That's going to work with your muscles, your ligaments, your tendons, the fascia of your body to help bring everything back into balance so you can function at your best. Its benefits include just that, helping relax the body and the mind, to help improve circulation, reduce pain, improve mobility, and huge benefits related to specific conditions depending on what you're coming in for treating. Often we'll treat a lot of chronic pain with massage therapy. So that's your low back pain, your hip pain, your foot pain, headaches, that's a huge one, TMJ issues, temporomandibular joint dysfunction, also known as TMJ, TMJD, TMD. There are a range of options that we can treat. Anything dealing with the body and dealing with how it moves is something that we can work on together. There are a variety of modalities and tools that can be added in your treatment depending on the training of your registered massage therapist. Treatments that we include are myofascial cupping and kinesiotaping. So myofascial cupping will work with the fascia, creating space, helping get everything moving and giving a different approach than just the compression of regular massage. Kinesiotaping is something that we can use as well to help maintain the benefits of the treatment, help relax the area more, help remind it to be more active depending on the activity and depending on what we're treating. Again, there's also a variety of treatments within the umbrella of massage therapy, including prenatal, youth, lymphatic drainage. There's a whole range of options, and you can just reach out, talk to the massage therapist that you're called to see if they can help treat what you're hoping to improve. There are different things that you can expect in the treatment. Again, it depends on who you see because people are people and we're all different. But what you can expect when you go in for a massage is to review your health history. If you've already been to that therapist before, there's less to review unless new things happened. But you'll go through what's going on currently and what you've been through so that we know what to treat moving forward. We know what might be the root cause of what's happening depending on your life history and your health history. And then we'll be able to customize a treatment plan for you for what you need that day. So you'll go talk through everything and that will be included in your treatment time. And then we'll go over the treatment that we'll do, step out of the room, let you get ready, and we'll knock before we come back in. And when we come in for the treatment, what you can expect is to be completely undressed underneath the massage sheet, laying on the massage table or as far as you're comfortable. Massage can be done over the sheet and directly on the skin or over the clothes. It will change, of course, the techniques that we use and the sensations that you experience, but both can be very effective. It just, again, depends on what we're treating. Then throughout the massage, we'll go head to toe if you want full body, or we'll just target the area that's causing you issues that day. And there will be treatment outside of just where you're feeling pain, because lots of times the pain might be, let's say, in the shoulder, but there could be a lot happening through the back, through the front of the chest, depending on what is going on. So we will use our assessment tools and the experience that we have to assess the highest potential root cause of what's going on and then target the areas accordingly. Throughout the treatment, there could be some areas that feel a fair bit uncomfortable, but one thing to always be mindful of is the good pain versus the bad pain. So good pain is that discomfort that you know is going to make improvements, that discomfort that you can breathe through, that discomfort that you're open to, that is not making you want to cry. You can cry in a massage, but for an emotional release, not because you're in that much physical pain because of the treatment itself. You might be in that much physical pain alone, and that's why you're in for the treatment, but not a causation of the treatment. And we want to emphasize that immensely, because if we're working through an area and you're either mentally or physically resisting it, then it's just a workout. We're going to work into your hand. When we work into it, you're just fighting back. We're not making any progress. So you want to make sure that you can breathe through it, that you can relax and be open to receive the treatment and communicate with your therapist. We'll use the pressure that we find effective, and we'll work through the deeper layers of the muscles if you want therapeutic, or we'll just keep it general if you want relaxation. So be open and communicate with us about what's too much and what's not enough. And then as we go, we'll go through different areas. We'll uncover the area that we're working on. So let's say we're working on your back, we'll bring the sheets down to your hips. If we're working directly on the skin for your treatment, we'll treat the back and then we'll cover it back up before we move on to the next. And then once we're done the treatment, we'll talk about what's come up in your treatment, the areas of concern, and the self-care that we recommend, because massage therapy and everything in life is a team effort. So you need to, one, coming in for a treatment is a huge step for your self-care, but then it's the maintenance outside of the treatment to help prolong the benefits and keep that investment of your time even more valuable as the days go on. So that's what you can expect there. After a treatment, you might feel like a good workout kind of sore. Again, that soreness that's like, okay, yeah, my body's done a lot, but I can still do my day-to-day activities. It's not completely unbearable. Things are feeling pretty good. Not like, oh my goodness, I don't want to move, it hurts so bad. So be incredibly mindful of that. And again, if you experience soreness, even if it's the good workout kind of sore, let your therapist know when you're in so that we know, okay, this is the results of this treatment. Is there anything we need to tweak or adjust? And then if it's too sore, then we can adjust the techniques that we did on that area, the amount of time we spent, and the pressure that we used. Everything is customized depending on what's going on and what you need that day. So communication is key so that we can deliver the best possible treatment for you that day. And how often might you need to come in for a treatment? That depends on what's going on. So 4 weeks is a really standard average for massage therapy, just once a month maintenance sort of style. You want to take some time for yourself, disconnect from the external world so that you have the safe space to connect internally and really see what's going on. And then if anything's coming up, if you had a more active month, things are feeling a bit sore, it gives us that chance to rebalance things, calm everything back down before you go on to your next activities. If you have something that's pressing, something that's creating more discomfort or has been a problem for quite some time, it took time for it to become problematic, it's going to take time to help relax it. So if it's something that's not too urgent, but still needs a little bit more maintenance, it might be once every 2 weeks. It might be a 30-minute treatment twice a week, depending on what's going on. Let's say you have like a lot of wrist pain or a lot of neck pain, and it's an area that you don't really have time to let it rest if it needs rest, or you don't have time to do the self-care to the level that is needed to make the progress that you want. So coming in for a treatment more often so that we can really tone it down, bring it down to a base level that is more manageable for you to maintain outside of the treatment room and makes everyday life that much more enjoyable. So it's a case-by-case basis, but those are some of the timeframes that you can expect or that you can plan for depending on what your case is. And for those of you who are hesitant to try or not sure the benefits or afraid that it might hurt or afraid that you don't feel safe, it's a very vulnerable setting. You are naked on a treatment table with a stranger. We understand that and we respect that. Our role and our goal is for you to have a safe space, for you to choose to come to this space because you want to achieve a higher quality of life. Communication will help you feel safe. And communication before you arrive to a treatment too. If you're not sure if massage is for you, reach out to the clinic that you're inclined to go to. Send them an email, give them a call, and ask them if what you're wanting treated is something that they have experience with, and if they have time to chat with you. And if you're worried about it hurting or being too sore after, communication again is where that comes in. So you're going to want to make sure you communicate with your therapist when your fears, so that we're more mindful of it throughout the session, and so that we can do our part to maintain the communication around that part even more open to help you feel more safe and comfortable. And you can also start with a relaxation. It's just general, not working into the deeper layers, not really digging into those trouble spots. So that's a really good foundation to start on to get you familiar with the practice of massage. And then you can work into more focused, more targeted treatments after that. To help with soreness too, you're going to want to make sure that your body is hydrated and fueled. That means that you're going to drink extra water after a massage to help flush everything out and keep everything hydrated. And you're going to want to fuel your body so that it has enough nutrients so it can do whatever it needs to do that day. Because massage is a lot of work. You're not the one doing it, but it's like a workout for your body while you're allowed to rest. So just make sure that you're being mindful of how you take care of it after that, with that in mind. And the benefits of pairing massage therapy with a variety of modalities that we will discuss in future videos is the fact of bringing more balance into your body through the soft tissues, calming the mind, making it more open, and in the mindset of being open to healing and the treatments. Lots of times too, there's different modalities that will involve more range of motion through the body, more assessment and testing that way, and having a more open, mobile foundation will allow those treatments to go to the next level and have even more success than if they would on their own. So some modalities that pair really well include chiropractic, physiotherapy, acupuncture. There's lots of other, it can pair really actually with anything in your self-care, just like all of these other modalities can as well. So including yoga practice, different exercises, things like that. And something that we can recommend for everyone to start today, and that we recommend always, is movement, specifically pain-free full range of motion. Pain-free, emphasized because sometimes there's an area of your body that actually does need rest. You break a bone, you can't just move it around. It does need to heal itself together, but then you need to keep that circulation and keep that movement. So pain-free full range of motion is moving all of your joints every way they're meant to move without pain throughout the day, every day. Throughout the day, because we get stuck in life, we get stuck in going through the activities of life, and that's why those repetitive strain injuries come in. So giving yourself that moment to open everything up, get everything moving, so full range of motion for your finger, little circles for your wrist, get everything moving, rebalance it, give it a chance to move every way it's meant to move, because our bodies are made to move, and when we stop moving them, and when we stop listening to them, that's where the problems come in. So just keep that movement. Everyone can do that no matter where you are, and it's something that's important always, regardless of your life, regardless of what we're working through. Pain-free, full range of motion. And what makes our practice unique, we're focused on the whole being and we're realistic. We're in depth about our assessments, about our health history intake, because we want to know the full picture, because what's going on physically is often rooted beyond the physical. And we're talking about all of the bodies. Physical, emotional, mental, spiritual. So many times emotions get trapped in the body, so many times trauma happens, and we recover and we get movement through the tissues, but they're still holding on. We wonder why we can't get more movement through our hips. We wonder why our back is always sore when we've seen everyone tried all of the treatments, done all the self-care, and it's not enough. Our practice is unique because we take all of that into consideration, and we are truly determined to help you achieve a higher quality of life. And we're realistic because we know we all have to start somewhere. You come in to see us today, maybe you just want to lay on the table, you don't want anything for self-care, you don't want to do anything when you leave, you just want to let everything fade away, let all your worries fade away and relax. That's an option. We're realistic because if you're coming in with a pain and a discomfort that's been building up for 20 years, we're going to give you self-care that you can build on to get the results that you want. And if you're not ready to do that self-care, that's okay. We're realistic with you. But to get the results you want, this is what needs to happen, and we'll adjust as we go depending on how things progress. But if you don't want to, that's okay. Just know that you're going to stay the way you are. We're realistic in making our plans and our treatments manageable and connect with what you truly desire. So even if it's a little bit more challenging, you'll be able to see the value in it and be supported no matter what way you choose to go. It's your life, and we're here to support you the best we can and give you the knowledge that you need to make the best decisions for you. That is what makes our practice unique. Let us know if you have any other questions about the practice of massage therapy. We will be more than happy to share with you. Send us a message, give us a call, send us an email if you have any conditions that you would like to learn more about the treatment of. And we will see you soon to learn more about different modalities and how they pair well with massage therapy. Thank you for joining us. Have a healthy and happy day.